Great. Welcome. Thank you for joining me this evening. I hope everyone can hear me. Just give me a thumbs up if you can. Wonderful. There's a chat box there if you'd like to ask questions throughout the webinar. So welcome. I can see a lot of familiar faces and names. So lovely to see you. And I hope everyone's surviving these crazy times. For those who don't know me, my name is Mim Beim, and I'm a naturopath. And I have been practicing naturopathy for coming up to 33 years, which does make me officially a dinosaur of a naturopath. So I love what I do. And about 25, 26 years ago, I did a very short little course on breathing, just 1 hour a day for 3 days. And it was Buteyko breathing. And in that time, it totally cured my asthma. I haven't had asthma from that day to this. And it wasn't until 2011 that I actually traveled to America to study with Patrick McKeown, who is one of the world's leading breathing experts. And there I did a 10-day training, and that absolutely transformed my life personally, but also professionally, because now I see a lot of things through the lens of breathing. And what seems such a fundamental and kind of ordinary process is really quite fascinating. So I hope that you'll find something interesting today. And for those, I know there's someone who's done this webinar before, and hopefully you'll be reminded of some things, but also I've added some new information as well. So I hope you find that interesting. Okie dokie. So before, I might just ask if everyone can mute themselves. Wait a minute, what I'll do is I think I can do that as well. Yes, here we go. You're welcome to unmute yourself, but we'll just start muted. Before I studied breathing, I really thought that taking a big breath was a good breath. So a big, deep breath in and a big, deep breath out was a good breath. However, here in the 6th century BC, the philosopher Lao Tzu said, the perfect man breathes as if he does not breathe. So it's a very, very different way of looking at breathing. Perhaps it doesn't need to be big. So just like you can eat too much food, or you can do too much exercise, or in fact, take too many steroids, which I think is the case here, it's not necessarily better for you. So more breath or more air is not necessarily a good thing. And in fact, it has a name. It's called hyperventilation syndrome. So hyper meaning over, ventilation meaning breathing. And it was named this by a doctor in the Civil War called Da Costa. In fact, they initially called it soldier's heart, because after the war, he saw, for years afterwards, he was seeing these soldiers coming back with a myriad of problems, of health problems. And initially they thought it was a heart condition, but in fact they found it was caused by over breathing. So when we're stressed, we breathe more, and these soldiers had been very stressed for a period of time, and it affected them. And it's also, shell shock could be one, and there's various accounts of people being in war who come back and their health has been negatively affected. And could it be due to the breathing? Overbreathing is taking more air than the body requires, so more fuel than the engine needs. And chronic, which means long-term overbreathing, is when it's become a habit. So this is the thing, that the pattern has been formed for whatever reason, and then it maintains that. And the body does this in a number of ways. It does this with bowels, it does this with sleep. You have a pattern. It may not be the ideal pattern, but the pattern stays. And so you really need to do something like retraining the breathing in order for that to change. Okay, so here are some of the signs that your breathing might be a little bit dysfunctional. So I'm also in the chat box, I have posted a PDF that you can download, and that's got a whole, this is what I use to assess people, whether or not they're going to benefit by breathing retraining. So here are some of the signs that your breathing may not be ideal. So snoring would be one, sighing frequently, yawning frequently, clearing the throat. So just pop in the chat box if anyone's got any of these symptoms, if you relate. So no one's actually going to come and book in to see me as a naturopath because they're sighing a lot. However, here's a list of conditions that may be associated with dysfunctional breathing. And these are the conditions that people do come and see me for. So whether it's anxiety or bowel problems, tonsillitis, teeth grinding, they're conditions that people will see a doctor or a dentist or a naturopath for. And so what I do now is I assess their breathing. And if they have a number of dysfunctional breathing symptoms and come in with one or more of these conditions, I'm going to wonder whether or not improving their breathing might improve their general health in the specific conditions. I'm not for 1 minute saying that breathing is dysfunctional breathing is the cause of every one of these conditions. I'm not. But it's interesting to see how much a part breathing might play. Sometimes it's 100%, sometimes it's 5%. But, if anything, if you can improve something by as pure a medicine as breathing, then that's pretty good, because, I do love using herbs and supplements and so on. But the breath is, kind of the most fundamental of all medicines. And so it's actually really, really very, I don't know, it's exciting to see the changes just with that one change. So the symptoms that you have, if you've got them, may be partly at least due to dysfunctional breathing. And the breathing exercises that I teach in my courses recalibrate the brain. So basically it's changed the neuroplasticity, changing the breathing center in the brain so that then your breathing changes. And that is for the long term. So unlike going to the gym where you exercise, and that's very good for you, if you stop, then, after a few weeks, you're back to square one. Whereas breathing retraining, once the brain has changed, it remains changed. So that is also a very exciting thing to see. Now, I've called this webinar the 3 pillars of breathing, and don't be scared by these technical names, but hopefully by the end of the webinar, you'll have a bit of an understanding why I'm calling the biochemical aspect or pillar, the biomechanical pillar, and the breathing cadence or pattern. So let's start by doing a breathing exercise. And this one is called 3x3 breathing. Simply, it's taking 3 breaths, and a breath is an inhalation followed by an exhalation. So inhale, exhale, inhale, exhale, inhale, exhale. At the end of your 3rd exhalation, I want you to pause for a count of 3 seconds, and then you start the pattern again. So it's 3 normal breaths. It's not big, it's not small, it's not special. 3 normal breaths and a pause. You don't keep exhaling, you just pause at the end of the exhalation for 3 seconds, and then you start again. So it's 3 by 3. 3 breaths, a pause, 3 breaths and a pause. And we're going to keep going, and we're actually going to keep going for 3 minutes. But before we start, I'm going to ask you to have a bit of a body scan and just assess how you are at this moment. And it could be stress as well. Are you feeling stressed? Give it a rating out of 10, 10 being the most. Is there any pain? Is there any tightness in the chest? Any physical or emotional symptom? Just maybe put it in the chat box. And what I'd like you to do is compare it at the end of the 3 minutes. Okay, so again, it's going to be 3 breaths with your nose, if that's possible for you. So 3 normal breaths, and then a pause, 3 breaths and a pause, and so on for 3 minutes. Okay. Alrighty. So just starting now, 3 normal breaths. At the end of the 3rd exhalation, a gentle pause for 3 seconds, and then you start the 3 breaths again. If you can't hold for that 3 seconds, you're welcome to just 1 second, just make it a very small pause. However, if you can pause for more than 3 seconds, I'm going to invite you to do that. So you're pausing until you feel the need to breathe again. In and out through the nose. The tongue is resting at the roof of the mouth, the tip of the tongue behind the front teeth, shoulders dropped and belly soft. 3 breaths, a comfortable pause. 3 breaths, a comfortable pause. Just notice if there's any more saliva. Give me a thumbs up or put in the chat box if you notice any more saliva in your mouth. Notice if you feel any warmer. Okay, fantastic. So we're coming up for halfway through. If it's comfortable, add a second to that pause. 3 breaths and a comfortable pause. Shoulders dropped, belly soft, tongue resting at the roof of the mouth, the tip of the tongue behind the front teeth. Noticing the breath as it enters and leaves the nose. Just got 1 minute to go. See how you're feeling. Just an ordinary breath, in and out, in and out, in and out. And just seeing if you can extend that pause, but it's got to be comfortable. This exercise should be easy, should be comfortable. Just the last couple of cycles. That's great. Just a few more seconds to go. Fantastic. So how was that? If anyone wants to open their mic, if anyone feels different, does anyone feel calmer? Does anyone feel more stressed? What's happening in your body after that?
Can you hear me?
Yep, sure.
Hi, Mim.
Hi there.
I'm definitely feeling calmer.
Fantastic.
Yeah, I feel a lot more relaxed. I actually feel a little bit sleepy though.
Yes. Okay. So I'll tell you what's going on there. It's not my relaxing voice. What's happening is that we're by a pause or lengthening the breath, we're building up carbon dioxide. So this is the biochemical aspect that I was referring to before. Carbon dioxide is a waste product. We do need to get rid of some of it. However, if you've been an overbreather, you've been eliminating too much. And there are various benefits of carbon dioxide, one of which is switching on the relaxing or the parasympathetic nervous system. And so that's, in the old days when people would have a panic attack, they'd get them to breathe into a paper bag, recirculating the carbon dioxide. So that's what we're doing with a lot of these exercises, is that there will be a pause or a lengthening or a change of the breathing to get the brain more accustomed to tolerating a slightly increased amount of carbon dioxide, switching on that parasympathetic or the relaxing nervous system. We know that that's switched on when you've got more saliva, because when the sympathetic or the flight and fight nervous system is switched on, you have a dry mouth. You're running away from the bear. So, the whole digestive system is not turned on. But when you're relaxed, the digestive system is ready to receive food. If you were to eat, it's in a much more relaxed state. And that's why you've got more saliva. Okay, so that's, now let's have a look at why I'm asking you to keep your mouth closed when you're breathing. And I hope everyone's okay with dogs. So let's have a look at the nose. What we think of the nose is this, the bit that just comes out the front of the face. But in fact, the nasal cavity takes up 1/3 of the skull, which is, when you think about it, and I'm going to, you know, I'm in New South Wales, we can talk about real estate. If you think about the real estate of the body, taking up 1/3 of the skull is an enormous amount of space. So that must be for a reason, okay? We're breathing in here. The air swirls around the nasal turbinates and comes down here into the windpipe or the trachea. While we're here, have a look at the tongue. We're going to be talking about the tongue soon. And the tongue is this really large, strong muscle, group of muscles, strongest muscle in the body for its size. So the air is coming down here into the trachea, and now we're into the body, into the lungs. It splits into two, into the bronchi, and then into smaller and smaller little airways called the bronchioles. And they end in the alveoli, which are like a cluster of grape-like structures, one cell thick, and that's where the oxygen that we're breathing from the air comes into the body, crosses over into the bloodstream, and the carbon dioxide that we make as a result of making energy is eliminated, and we breathe out through the nose. So this is actually someone's lungs. This is a resin cast of someone's lungs, and this is the trachea, the bronchi, the bronchioles, and the alveoli have, in this instance, been removed. Now, if you were to measure, and someone has, obviously with a very small tape measure, was to measure the amount of area, the surface area available for oxygen delivery, it's as big as a tennis court, all wrapped up in the size of our lungs. So quite extraordinary. All right, so why do you want to breathe through the nose? Well, you've got one for a start, but it filters the air. So all of that nasal cavity is lined with lymph or immune tissue, and that is able to inactivate bacteria and viruses, hello viruses, and get, you know, kind of grab pollen and dust so that it's eliminated before it reaches the lungs. In fact, it's believed to be 3/4 of bacteria and germs are eliminated by the lymph tissue in the nasal cavity. So, you know, if you're mouth breathing, and mouth breathing doesn't mean, it just means having the mouth open. So a mouth breather is someone just who has their mouth open. And with that, the air or the pollen or the viruses are simply going to go straight into the lungs. So the nasal cavity is our first form of defense. It also warms and moistens the air. So if the air is, say, 6 degrees centigrade, by the time, if you're breathing through your nose, by the time it's at the back of your throat, it's 30 degrees. And by the time it's in the lungs, it's 37 degrees or body temperature. Now, if you're an asthmatic, you will know that cold, dry air will possibly trigger an asthma attack. But even if you're not asthmatic, it's actually quite traumatic for the lungs. They are internal organs, and so they want body temperature and it's moist. So they don't want to be struggling with cold, dry air. It also regulates the amount of air. So I hope you're kind of getting the idea now that maybe big is not better. So the nostrils are smaller than the mouth, and that's maybe the amount of air you're meant to have. So we're already limiting, or we're getting plenty of oxygen. If you can breathe through your nose, you're getting plenty of oxygen, but it's not over breathing. It's also slowing and quietening the air. So if you're breathing through your nose, remember it goes through those nasal turbinates and then it settles into the lungs rather than this cold, hard blast of air like that. Okay, now if there's anyone out there who snores or has got sleep apnea, if you can think about it, that's basically an overbreathing condition. And if the trachea, the windpipe, is this semi-collapsible tube, it's got a bit of cartilage, but it's basically just muscle. And if you're breathing hard and fast, like a snore, that tube can collapse. It can collapse a little bit, which will cause the snoring sound, the vibration over the voice box, or it can collapse altogether. And that would be one of the reasons causing an apnea or a pause in breathing, so obstructive sleep apnea. one of the causes. So what we try to do with the breathing course is to retrain your breathing so that even when you're unconscious at night, the breathing will be calmer. Okay, so we've had a look at some of the benefits of nose breathing. Let's have a look at some of the problems with mouth breathing. Well, you are going to increase your risk of snoring. So it's thought that over about 40% of adults snore. And there's actually quite a high percentage, something like 8% of adults have sleep apnea, and it's not just adults, children can have obstructive sleep apnea as well. If you breathe with your mouth open, you are actually getting 10% less oxygen. So that's called the Bohr effect. It's seems paradoxical basically, but if you're able to increase your carbon dioxide levels, you're actually going to get more delivery of oxygen throughout the body. You're more inclined, if your mouth is open, you're more inclined to have temporomandibular joint pain and dysfunction, malocclusion, so wiggly teeth. So I'll actually show you a little video on that in a moment. Particularly for a growing child, if their mouth is open, their face isn't going to develop as it should. Gum disease. So with the mouth open, you've got less saliva, and in the saliva are enzymes that are able to inactivate the bacteria that cause dental caries and gum disease. Enlarged tonsils and adenoids. So the first line of defense, the lymph tissue, is in the nasal cavity. The second are the adenoids in children and the tonsils. So with children or adults with enlarged tonsils and with children adenoids, it's fairly certain that they'd be a mouth breather, because that's they're taking over the role that the nasal cavity had. You're more inclined to have learning difficulties, increased risk of asthma, and of course, increased risk of colds and flus. So really important to learn to breathe through your nose day and night. Now, this is a product that Patrick created about a year ago now, and it's called Myotape, and it's really helpful for helping keep the mouth closed. So this could be for adults or children during the day, if you're doing some screen time, and it kind of like, because of the elastic recoil, it helps keep the lips closed. It's what we call lip seal. And also at night when you're unconscious, this is a way of having the mouth closed while you're sleeping. And why Patrick created it like this is that you can also, if you need to, you can talk, you can drink, you can, you can open your mouth if you need to, but it's kind of gently keeping the lips together. All right, now let's have a look at, so that was the idea of breathing through the nose, and that affects the biochemistry. It means that where carbon dioxide levels are going to be a little bit higher than they are if you're a mouth breather, where you're eliminating that carbon dioxide all the time. Okay, let's have a look at diaphragmatic breathing. Oh, wait a minute. I think I need to put the sound on.
Essential gas, oxygen from the air. Expanded lungs naturally contract to expel the body's waste gas, carbon dioxide. Your lungs usually expand and contract in two main ways. One is an unconscious downward and upward movement of a thin muscle called the diaphragm, which separates the chest from the belly. The other way is by raising or lowering the ribs to increase or decrease the volume of the chest cavity. We breathe in or inhale when the diaphragm contracts. This pulls the lower part of the lungs downward. When we breathe out or exhale, the diaphragm and lungs relax and return to their resting positions. Quiet, deep belly breathing is a more consciously controlled breathing that, with practice, can become the standard way you breathe. Deep belly breathing aids the diaphragm muscle movement by expanding and contracting the abdomen, the area below the diaphragm. This allows the belly muscles to push stomach and diaphragm up, which forces out more carbon dioxide waste.
Okay, so the diaphragm is the main breathing muscle. It's shaped like that. It's a domed muscle. It's actually really quite big, but it's very thin. And when we breathe in, that muscle works. It contracts down. And so it allows the lungs room to expand, and you're breathing right down into the lower lobes of the lungs. And then when you breathe out, it goes back into its dome shape. And so the air is kind of recoiled out. This is called belly breathing, not because we're breathing into the belly, but what's happening is that contraction of the muscle pushing down the abdominal organs. And so that's why, you can see the belly slightly expanding, but it's quite a global movement. It's not just the belly. If you wanted to put your hands on the two floating ribs, it comes out there. And if you were able to put your hands on someone's back, you can notice that. So it's just inflate. It's like this balloon inflating. So if you're not using your diaphragm, and people, to a certain extent, we're all using the diaphragm to breathe, but people have lost using it. They're not using it to the full potential, and if you're not using it properly, then you are using what we call the accessory breathing muscles. And these are the muscles, these are the trapezius here, the sternocleidomastoid here, the scalenes here. So if you're using those 20 to 30,000 times a day, you can just imagine that that's going to lead to some sore shoulders. This then it could be headache. It inserts here into the muscle going over the scalp. It can be causing teeth clenching, grinding, pain. This temporomandibular joint, that muscle starts there, goes down to the clavicle. So I don't know whether anyone relates to this, but often sore tight shoulders are not because you're typing all day, but because you're not using your diaphragm. So I rarely see people using their diaphragm effectively. And I think why not is that when we start sitting in chairs or even cross-legged, you're kind of going to be a little bit stooped. And so the diaphragm can't move properly if you're stooped over. So if everyone's sitting down, I'm going to teach you how to sit in a chair properly. So I want you to stand up, and I want you to point your bottom to where the back of the chair meets the seat of the chair. So point, and sit. Do you feel that you're a little bit straighter? Just a little bit? Yeah. So that's going to allow the diaphragm room to move. So I think that it's sitting. I also think there's a bit of a culture of holding your belly in, so if you suck your tummy in, you can't use your diaphragm. The tummy is meant to be relaxed so that the diaphragm can do its work. Also, there are, when we're told to put the core on, so the core is this pelvic floor muscle, or the pelvic diaphragm it's called. So we've got the respiratory diaphragm and we've got the pelvic diaphragm, and they're meant to be this beautiful movement going all day long that's massaging the internal organs. So if you've got your core switched on, it's meant to be switched on when you're wanting to brace the spine. So I'm going to lift, I'm going to push, core on, but the rest of the time it should be relaxed. Now we're looking underneath. You can see I'm a bit obsessed by the diaphragm, so we're continuing to, and this is the biomechanical or the anatomical part of breathing as well. So we've touched one using the nose and two using the diaphragm. So we're underneath the diaphragm, and you can see what a big muscle it is. It attaches to all of the ribs, also to the xiphoid process, which is that little bottom bit of the sternum, and also to the spine. So sometimes people's back problems can be because the diaphragm is contracted. There's one of the biggest lymphatic vessels under here. So this is massaging and improving the flow of lymph. And lymph is this amazing fluid that carries fat, and also our immune cells, and also metabolites or toxins. So getting rid of those to go to the kidneys and liver. So, you know, that's amazing kind of all day long, this massaging, that if you don't use your diaphragm properly, it's not working properly. It's also an amazing, helps the flow of blood from the lower body to the upper body. So here's the inferior vena cava, huge vein, and the aorta artery, helping the transport of blood from the lower to the upper body, and that was massaging. And here is the esophagus, the eating tube, and so the diaphragm actually goes around. So that's the diaphragm there, and that's the esophagus there. And that is called the lower esophageal sphincter. So the lower esophageal sphincter is the diaphragm. And it's thought to be up to 40% of reflux is due to poor diaphragm activity. So that's pretty amazing, isn't it? Again, it's not every case, but it's just like, you know, someone's got poor breathing and they've got reflux. It's like, let's give this a shot. Let's see. Okay, now let's talk about breathing pattern. And we're going to do this as an exercise, and I'll talk you through it. So again, we'll do it for 3 minutes, but I'll just set it up. So I'm going to ask you to breathe in for a certain number of seconds and out for a certain number of seconds. And each of you is going to be different. So I'm going to count 2 seconds in, 3 seconds out for a few breaths, and then I'll say change. And then I'm going to count 3 seconds in, 5 seconds out for a few breaths, and I'll say change. And then 4 seconds in, 6 seconds out for a few breaths. And then you're going to decide which feels the most comfortable. And then we'll do that for 3 minutes. And then I'll talk to you about what's happening with that breathing exercise. Is that clear? So if you can breathe through your nose, I'd really like you to do that. If you can't, just do the best you can. So it's breathing in and then out, and I'll count. Any questions before I begin? We okay? Okay. All right. So we're going to, I'll start at 2 seconds in, 3 seconds out, then go to 3 seconds in, 5 seconds out, then 4 seconds in, 6 seconds out. There's no one that's better. It's just what suits you, what feels comfortable in your body. Breathing in, 2, and out, 3. In, 2, and out, 3. In, 2, and out, 3. Change. In, 2, 3, and out, 3, 4, 5. In, 2, 3, and out, 3, 4, 5. In, 2, 3, and out, 3, 4, 5. Change. In, 2, 3, 4, and out, 3, 4, 5, 6. In, 2, 3, 4, and out, 3, 4, 5, 6. In, 2, 3, 4, and out, 3, 4, 5, 6. So what felt good for you? What felt right? Did any of them feel right? Was it the 2, 3, the 3, 5, or the 4, 6? Maybe just write it in the chat box. What felt the best for you? There's no right or wrong. Okay, so now we're going to do this for 3 minutes at the rate that suits you. That's great. A lot of people are 3 5s. There's a few 4 6s, a couple of 2 3s. It doesn't matter what feels right or comfortable for you. And you know what? After a minute or so, you might find, if you were doing 2 3, that 3 5 is going to be fine. So I am not going to. I'm going to start you off by doing 2, 3, 3, but then I'm going to leave you to do it so that, because my counting may not be the rhythm or the cadence that suits you. Fantastic. Okay, so let's start. Breathing in, 2, and out, 3. In, 2, and out, 3. In, 2, 3, and out, 3, 4, 5. In, 2, 3, and out, 3, 4, 5. In, 2, 3, 4, and out, 3, 4, 5, 6. In, 2, 3, 4, and out, 3, 4, 5, 6. So keep going in a rhythm that suits you. So it could be 2 seconds in, 3 seconds out, 3 seconds in, 5 seconds out, 4 seconds in, 6 seconds out. It doesn't matter. So shoulders dropped. If you can breathe in and out through the nose, that's great. And the tongue resting at the roof of the mouth. Just noticing how it feels in the body. Halfway through. Just watching the breath as it enters the nose, as it leaves the nose. Okay, so what's going on there is it's generally a slower breath for most of you, regardless of what. So that means that we're increasing the carbon dioxide. So that's that. And there are other benefits to increasing carbon dioxide. But the other thing is that we extended the out breath. So when we breathe in, we activate what's known as the sympathetic nervous system. That's the flight and fight nervous system. When we breathe out, we activate the parasympathetic, or the rest and digest. So for most of us, we need both. The body needs to have both. It's not that they're not, we can't have all of one and none of the other. But for many people, we are what we call sympathetic dominant. So we're always wanting to kind of hang out a little bit more in that parasympathetic place. Yeah. So I don't know, did anyone feel more relaxed with that? Do you like that? So that's another kind of, I guess, a hack, if you want to say, of switching, helping to be more in that parasympathetic or that relaxed state. Now, which each of these exercises that we've done so far, the 3x3 breathing or this cadence breathing to a pattern, you could do that as a kind of a formal exercise if you like, doing 5 to 10 minutes twice a day. And that's going to have a profound effect. In fact, this cadence breathing, they've done a rather large study on 10 minutes twice a day. And that alone improved. It was a large study, like several thousand, I should be a bit more specific really, but it improved high blood pressure, diabetes, anxiety, and there was one other thing. But, you know, so just that simple exercise. So you could do these as a kind of like, I'm going to formal this exercise, or you can do it kind of incidentally. So just when you're on the, you know, waiting on a call or a Zoom call, just do some breathing exercises. So in the course that I teach, I teach these ones, but there are a lot of other exercises that can be more specific to each person. And basically, we need to do this quite a lot over the course, because it takes several weeks to really to make that permanent change. So it's all very well to feel relaxed when you're doing a breathing exercise, which is great, but we actually want to have that change to be permanent. Okay, so I've been talking about the tongue and the tongue position. You may have wondered where the tongue should live. Where should it be? Well, obviously in the mouth, but is it at the top of your mouth, the middle of the mouth, or the bottom? Where is it for you? Anyone want to open up the mic or top? Okay, fantastic. Now, everyone, open your mouth just slightly. And where's the tongue? It's dropped. Okay, so if you're a mouth breather, your tongue is in the wrong position. It can't be at the top. And that's bad for a whole lot of reasons. So how do you know where the right position is? Well, it is called the spot. And how you can access that is to make a popping sound, a click. And before the sound itself, before you make the sound, your tongue's in that position. So go to make a popping sound, and you feel that the tongue is just kind of suctioned up there. So that's where it should be. So it's the tip of the tongue there, but about 3/4 of the blade or the whole tongue should actually sit there on the roof of the mouth. Now anyway, talk about me later. The other way you can find the right spot is to smile with your mouth closed and swallow. Did you feel it suctioned up there? So that's where it should live. And you know what? You can train your tongue to live there. And even when you're asleep, it will still live there, it will reside there. And that's where it should be. Okay, now the tongue is really quite interesting. So it's, I don't know whether you've heard of fascia. So we've got muscles and we've got bone and we've got fascia. So it's F-A-S-C-I-A. And fascia is like cling wrap. I hope there's not too many vegans out there. But when you see meat and there's this kind of like, it's like this cling wrap around the muscle fibers. And it actually goes around all the muscle fibers. So the fascia connects our tongue to our toe, our big toe. So this is the tongue. It goes through the lungs, the diaphragm. Here's the hips, the knee, and then the big toe. So where we put our tongue influences the rest of the body. Where we put our tongue influences our posture. So having the tongue on the bottom actually negatively influences your posture. It's quite amazing. And there are trigger points or reflex points there where the tongue is. If the tongue's up there, it's going to help you diaphragmatically breathe. If you're breathing through your nose, it's going to help your diaphragm to move. There are nerve connections throughout the body. All right, now this is a little video of the changes why it's particularly for children, the growing skull.
A normal top jaw should look like this. The arch is wide and U-shaped, formed by the tongue as it rests in the roof of the mouth. There, it counteracts the pressure of the cheeks, which would otherwise push the upper arch of the jaw inward. However, if a child sucks their thumb or habitually breathes through their mouth, then the tongue drops from the roof of the mouth and the upper arch of the jaw gets pushed in to create a less attractive, longer, and narrower face with crooked teeth. In addition, when a child habitually breathes through his or her mouth, the top and lower jaws become underdeveloped and set back from their ideal position. This negatively affects the appearance of the face, making the nose look larger and, more importantly, reducing airway size.
So it's, a really important thing for the growing child. Even up into, for men, even up until 20, where the skull can change. I unfortunately didn't have that information when I was a child and did suck my thumb. And so and where that that upper it vaults up, will actually take the space in the it takes space up into the nasal cavity. So, you know, it's having a negative impact there. But so even if your tongue doesn't comfortably fit in your mouth because you've got a narrow upper jaw, so this, you know, if anyone's had teeth removed, you know, it's possibly because you were a mouth breather as a child. And so, you know, you do what you can. All right. And this is a new product that's just been invented by a couple of a dentist in Queensland, actually. And it helps you keep your tongue on the spot. Is actually called the spot. And so these are a bit of fiber, and you stick them up there. And it's good for children, but also for adults. So if you do that for an hour twice a day, after, I think they did the studies of 4 weeks, your tongue is trained. So they're called myospots. All right. So we've had a little look at so far the biochemical aspect, where you're increasing your tolerance to carbon dioxide. It has, you know, it has benefits for switching on the parasympathetic nervous system. It also improves oxygen delivery in the body. It also improves blood flow because it relaxes the smooth muscle of the blood vessels. It's also got sports performance benefits, that you'll be able to recover more from exercise. There'll be less lactic acid burn. Then there was a biomechanical aspect, and that's basically use your nose, use your diaphragm, and where's the tongue. And then there was a cadence. So we did a cadence exercise. So that is not normal breathing, nor is 3x3. So they're not normal breathing. They're an exercise. And they've got the reasons for that. So normal breathing is slow and regular, using the nose, using the diaphragm. Okay, so you can use them, you know, 5 minutes every hour, or 10 minutes twice a day, or just from time to time. So I must have raced through all of that. So are there any questions? You can unmute yourself. Or put it in the chat box.
Mim, are these particularly good exercises to do, for instance, as you're going to bed, or can you do them when you're lying down?
Yeah, you can do them sitting and lying. Hello, Claire.
Hello,
and and yeah, perfect. So if anyone has, and they're going, if you do some breathing exercises in bed, that will inform your night breathing, where we don't have the control. Nighttime breathing, you don't have control over. And that's why doing the exercises during the day that will help the nighttime breathing until your brain has reset, basically. But yes, if anyone has insomnia or snore or has disturbed sleep, then doing some of these breathing exercises can be really effective. In fact, Patrick's got, and I'm very happy to, if anyone wants to email me, I can send a link, actually probably linked by Dropbox, to Patrick's got a wonderful 20-minute audio. This is Patrick McEwen I'm talking about, that he did a few years ago, but it's so effective of kind of changing the breathing as you're going to sleep. Yeah, let me know, email me tomorrow, and I can send anyone a link to that. There was a comment before from someone saying that you're yawning a lot. This is really common, yawning and sighing, when you're doing the exercises, if you've not been used to it, because what's happening is we are, the brain is used to, if you've been an overbreather, the brain is used to this much carbon dioxide. By doing the exercises, we're challenging that. And so the brain is going to say, what are you doing? Get rid of it. And so you yawn, you'll sigh, you'll cough. It's really, really common until it gets used to it. So basically, we're kind of building it up so that your new normal, it's never going to be too much. Your body will not allow that. So if your normal's been here, your new normal will be here. and that's what we want, and we want it to stay there. So that's why you do these exercises that kind of push the boundary so that your brain then recalibrates, the breathing center recalibrates to that being the normal, the new normal. Any other questions?
Mim, it's Anna. Hi.
Hello.
Thank you for that. Just one question with the method that you teach, the Buteyko method, if I'm saying that correctly.
It's all right, Buteyko, it's fine.
Yeah. How what we learned today, and I did miss the slight intro, and I'm sorry. Is that sort of foundation to that method?
The Buteyko, and in fact, why I've chosen Patrick McEwen as my teacher is that, yes, it's based on Buteyko, but it's more than that now. Buteyko Konstantin Buteyko was a Russian doctor in the 70s, 80s, 90s. He died in 2002, and he was researching the effect of breathing on blood pressure, but found that changing the breathing helped with asthma and a whole lot of other conditions. His was mainly reducing the amount, so he was all about carbon dioxide, all about increasing carbon dioxide. And so what I teach has that as a fundamental, but it's also, where's your tongue? Are you using your diaphragm properly? So it's, you know, like more than that. It's more than carbon dioxide is good breathing, but definitely it's a big part of the exercises that I use. And both of the exercises that we did today, they aren't traditional Buteyko exercises, but I'm using those principles of that you're slightly increasing your carbon dioxide. So, and I don't know whether that answered your question or not.
I suppose then in hearing that, the two methods that we practiced today, if we employed those on a regular basis, as you suggested, would that be enough to change any condition?
No, generally not. No, there are other ones that are a little bit more challenging that you'd need to be doing. You kind of really need to be quite committed to that permanent change. Right. These ones will help. They will, help you in the moment, and it's a little bit like meditation, which is amazing. And all meditation will involve at some level your breathing changing. So if you notice that they can either focus on the breath, but your breath will change. And from a physiological point of view, that's what's happening. That's the benefit of meditation, is the breathing. I know there are other aspects, there's spiritual aspects and, more esoteric things, but from a physiological point of view, that's why meditation helps to lower blood pressure, helps anxiety. It's all about the biochemistry. It's all about the carbon dioxide. So, there are other aspects, but to get that ongoing improvement with anxiety, for example, you'd need to be committed to doing the exercises for a few weeks.
Yeah.
And then you could top it up, but you do. Yeah. So those little ones that I taught, they're not generally going to be enough to really shift that, recalibrate those breathing centers in the brain.
Thank you.
Great.
Last question.
Yes, sure.
Mim, at the moment, a lot of people have to wear masks, or at least in Sydney.
Yes.
Do you think that's causing havoc with breathing?
Actually, thanks, Maha. Good to see you. In fact, I wrote a little blog on that called the mask anxiety. Now, it's a Buteyko teacher's greatest gift is to learn to breathe with a mask on. And in fact, it's going to increase your carbon dioxide levels. So if you can kind of just get your head around it, keep your mouth closed while you're breathing with the mask on, it is actually going to do the work of quite a strong breathing exercise of increasing your carbon dioxide. So in fact, it's quite a positive. I mean, I think there's, like we're using the same one, God knows how many germs there are, but anyway, it is what it is. And if you can, so don't, you're probably not going to jog with one, although interestingly, Patrick invented a sports mask a few years ago, little knowing how popular it was going to be, because it does improve your athletic performance. So I know, for mouth breathers, wearing the mask is a big, it must be awful. But if you can think of it as a fantastic opportunity to do some breathing exercises, then I mean, I guess that's the way we try to cope with all of these changes. You know, is there a positive? And so from a breathing teacher's point of view, it's good. Strangely, yeah.
It's Lionel.
Hi, Lionel. Your mouth breathing, Lionel.
Yes. I hate the mask. I can't cope with that at all. But
yeah.
Back to the exercises that we practiced tonight. Would you recommend that I try and continue with that?
Yeah. Lionel, what I'm going to say, because I know I can imagine that the mask must be awful for you because your mouth is often open. I can see that. Yeah. I want you to practice for me. Can you see that your mouth's open now?
Yes.
My voice is going to be in your head. You'll need to have therapy for that, but I want you to keep your mouth closed all the time. Okay. Except for when you're eating and talking, okay? That will be the best exercise for you. And then you'll be able to tolerate the mask for however long we have to wear them.
Well, I've restricted myself to not going out so I can eliminate that.
Yeah, wow, okay.
As much
Lionel.
as possible anyway.
Yeah, okay, poor you. All right. Look, if I promise you, if you can get comfortable with having your mouth closed all day, then you might find that you'll be able to tolerate the mask, because it's all about that you've been used to losing that carbon dioxide with your mouth open. You wear the mask, we've got an increase in carbon dioxide and your brain's having a fit.
Yes.
Yeah, it's just like, you know, it will make you feel very breathless.
Exactly, yes. I feel like I'm going to suffocate.
Yes, that's the feeling. And in fact, it's not, people say, I'm not getting enough oxygen. It's not that. The brain actually doesn't really care that much about oxygen. I know that sounds bizarre because we need oxygen, but it reads carbon dioxide. So when the carbon dioxide level goes up and the brain's not used to it, it says, breathe more, get rid of it. And so that's causing the anxiety, is the buildup of carbon dioxide rather than low oxygen. Mm-hmm. So it's you know, I don't know, we're not really taught this. It's quite strange. You kind of like, people think, oh, well, carbon dioxide bad. Well, no, it's actually, you know, get used to it. So Lionel, that I can already see that would be the biggest thing for you. And if you were to do a course with me, that would be my aim for you, is that you're able to go, and your mouth is beautifully closed now. Fantastic. I'm hoping the tongue's resting at the roof of the mouth. That alone, within a week, you will notice changes. You will notice an improvement in your health in other ways as well.
Well, I hope you're correct.
I am.
I'll endeavour to do the best I can.
Will you email me? Lionel, you email me and let me know how you go in a week or two. Okay?
Thank you.
I promise you. I promise you will feel better for it.
Thank you very much.
Great.
Hi to everybody.
Thanks, Lionel.
Thanks, Mim.
Thanks, Lionel. Question here is optimal way to sleep. Actually, on your side, Zara. If you're sleeping on your back, it's very easy for that tongue to fall down. So sleeping on your side, remind yourself before you go to sleep where your tongue is, and maybe you need to use some Myotape or something to keep the mouth closed, but side sleeping.
Thank you.
Great. So pleasure. So if you'd like to, it wasn't a video of Patrick, it was a, here is Oscar the cat. There we go. Thank you, Oscar. He's actually incredibly shy of people, so he's got no idea he would run a mile if he thought that people were watching him. Emiroski Boski, thank you, the star of the show. There we go. And I've got the dog below there. So yes, if you want that audio, happy to send it. I'll send it via Dropbox. So thank you, everyone. I will actually record this is being recorded. So if you wanted to watch it again, or if you think someone would find it interesting, let me know. And if anyone is interested in doing the course or getting some Myotape, I will send an email and there'll be a discount code that you can use. So thank you, everyone. Thank you for your interest.
Thank you.
It's
Thanks
been
a lot,
lovely to see
Mim.
you.
That was really good.
Thank
Really
you.
enjoyable. Thank you
Lovely.
very much.
Thanks, Gordon. Thanks.
Super
Lovely to see a
informative.
lot of
Thank you,
faces I haven't seen
Mim.
for ages.
Thanks, Mim.
Thank
So
you.
generous. Thank you very
Oh
much.
no, my pleasure.
Thank you,
It's been lovely to
Damien.
see you all. Okay. Bye,
Sweet
Claire.
dreams.
Bye, Michelle.
Thank
Bye.
you, Damien.
Bye.
Bye.
Bye.